Everyone, Dr. Emmy from Pain Free and Fit. Today, a great video for those of you with degenerative discs, herniated discs, and bulging discs in the lower back. We're going to be going over bar thigh squats, a great exercise to train your legs heavy without compressing and irritating your discs. Hope you enjoy. So in setting up weight training programs for both my patients and my online clients, one of the things that always comes up is people with degenerative disc disease, worn out, thinned out discs, herniated discs, and bulging discs always ask, how can I train legs heavy with these disc herniations? Squatting is one of my favorite things I hear all the time, but it aggravates my discs. Well, of course, because with regular back squats, when the bar is across your shoulders, you have a vertical compression. Same thing if you get into a hack slide type apparatus. Same thing if you're getting on a leg press, because a leg press, even though your back is flat against the back of the support, as your legs come down at a certain depth, your pelvis is going to start to flex, and if you put your hand in your lower back, you'll notice your lower back starts to flex. That aggravates discs. So compound exercises are very important still to do for leg training, hip training, but how do we choose things that aren't going to aggravate us? Well, enter the bar thigh squat exercise. Great exercise where you lay a bar across the top of your thighs, hold on to it, and as you squat, the bar is supported by your thighs. So the pressure or the weight is still on your hips and your legs, but it's bypassing your lower back because that weight is centered right here on your thighs as you're holding that bar, and it's taking a lot of pressure out of your lower back. However, people that do bar thigh squats, many times as they get to the top of the lift and the legs start to straighten, there's less of an angle with the leg. Down here, the bar is nice and stable on the thigh. But as the thigh comes up, the bar wants to slide down the thigh. So it takes more upper body strength with the lats and the extensors of the spine to hold yourself up in your neutral spine as you come up. Unfortunately, many times towards the top, you're going to be aggravating your lower back. So if we perform our bar thigh squats with power resistance bands situated so that they're anchored slightly above and behind the bar, they assist our hands in pulling the weight back into our body, so the bar has less of a tendency to slide down our thighs. This is important also for accommodating resistance. One of the things that stretch bands will do is the weight will be easier to lift at the bottom and harder to lift at the top, where you're mechanically stronger. So it takes into effect a great training aid to help you when it's easy to lock out a squat at the top quarter or top third. With the bands now, you're having more weight. It's tougher. So it provides a greater training stimulus for the hip musculature and the leg musculature. When you set your bar up, by the way, there's going to be a certain amount of weight that you need to keep the bar flat on the pins. If you're using a power rack like I am, that's probably the best situation to do. You could use a bench if you're training at home and just lay the bar across it and straddle the bench, but probably better to do it in a power rack. Make sure that you test yourself carefully with this. Don't have the bands attached before you load the weight on the bar, because the bar will, of course, tilt side to side, and injury is very common. So you want to make sure you load it up, have a stretch band that you can still stretch down, get on the end of the collars, and keep yourself straight. So let's give this a set. I'm going to take a sumo stance for this one. You can do this with a parallel stance, meaning a narrower squat stance, of course. But for disc herniations, a parallel stance has a tendency to cause a lot more of a tendency for people to cheat and come out of their good posture form in their neutral spine and flex the spine, which could be very deleterious for discs. So sumo squatting, where it's more of an upright motion with less pelvic flexion and then, of course, unfortunately, lumbar flexion, is a lot better for squatting on hot discs where you're having a lot of pain. Decreases your chances of going into flexion. So I'm going to engage my neutral spine. Remember, that's different for each and every one of us. For me, I'm putting the right amount of pelvic tilting on for my body. I've determined that through an analysis. If you're not sure what your unique mechanics are and neutral spine position should be for you, go to the painfreeandfit.com website. Check out our free body analysis. It's based on all your unique movement tendencies, muscle imbalances. We all have our unique posture issues that contribute to mechanical stresses on our discs and our lower back. So for me, I'm going to keep the right amount of pelvic tilting on. I'm going to make sure I keep my left hip down, because I have a tendency to raise my left hip when the set gets heavy. and I'm going to have a tendency to lose my multifidus contraction at L5 on the left side. So I'm going to keep those things in mind, set myself up with a little hip down tension, not movement but tension, and my multifidus engaged along with all my core before I do the set. You're going to do something different. You may have to think about slightly rotating your rib cage because you have a tendency, because of abdominal oblique imbalance, to slightly turn when the set gets heavy. You may have a tendency to keep your other hip down. You may need to shift weight of your knee because as your knee turns into valgus, it creates an increased arch in the lower back. So remember, we're all unique. You need to find out what your unique muscle imbalances are, what your stability issues of your spine are based on a good body analysis so you can check that and hold that. That's your greatest chance of avoiding injury when doing squats or any type of exercise. So I've loaded 405 here on the bar. I'm going to take my sumo stance. Before I get under it, I'm going to engage that core the way I talked about for my unique body. I'm going to keep the bar tight in against my hips. You notice it's way in tight, not mid-thigh, but all the way down. Spine is a neutral, and I perform my set. You'll notice very little pressure on my lower back. The bands are assisting my hands in holding the barbell into me. Nice weight on my lower extremities. Can feel my glutes, quads, hams working. Do have some activity in my low back, erector spinae muscles and my lats. And that's the failure. So check out the bar thigh squat exercise with bands. Remember, the further back you have those anchor points, the more it's going to help to pull that barbell into your midline. It's going to avoid the typical tendency for it to slide down your thighs as you get higher in the range of motion. And of course, that's going to reduce the chances and the need for you to pull with your hands and put excess pressure on your back through vertical compression and through the tension in the lats that you're pulling with to the low back. If you've enjoyed this video on bar thigh squatting with resistance bands overhead, check out our channel. Got a lot of great videos. Subscribe. Help you with degenerative discs, herniated discs, and bulging discs. If you were looking for a great program to figure out what your body mechanics are, how to find your neutral spine for your body, how to identify muscle imbalances and issues that are contributing to your low back disc pain, check out our fast track program for degenerative disc disease at painfreeandfit.com. It also applies to herniated and bulging discs. I hope this video on bar thigh squatting helps you with your chronic lower back disc injury.